Hello, I'm Professor Emily Mercury, and this is Chapter 14, Cardiovascular System Medication in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to identify the different types of antiarrhythmics, general indications, side effects, and causations, classify the most commonly used antihypertensives and their side effects, describe the different types of coronary vasodilators and their cautions and side effects, understand the 6 antilipemic categories and describe their actions, describe antithrombotic agents in terms of administration, action, typical drugs, and antidotes, and explain appropriate and important patient education for all cardiovascular system medications. I highly recommend for this chapter that you go back to chapter 13 and review our different drugs of the central nervous system, what adrenergic, cholinergic, those kind of side effects are, because that's all going to tie in with this lecture as well. Cardiovascular system medications. Cardiovascular drugs include medications that affect the heart and blood vessels, as well as anticoagulant and antiplatelet agents that prevent clotting. The following are different categories of cardiac medications: cardiac glycosides, antiarrhythmic agents, antihypertensives, vasodilators, antilipemic agents, anticoagulant, platelet inhibitors, thrombolytics, and hematopoietic agents. This chapter focuses on antiarrhythmics, antihypertensives, coronary vasodilators, and antilipemic and antithrombotic agents. We will go over each of these, but if you are ever looking at words, I always want you to remember to kind of break them down. So anti is against, arrhythmics is an abnormal rhythm. So against an abnormal rhythm, these will treat arrhythmias. Antihypertensives, against hypertension or high blood pressure. So drugs in this category will treat high blood pressure. When we talk about vasodilators, vaso is talking about the blood vessels. Dilator means it opens up the blood vessel, which will help with hypertension by reducing the amount of resistance to blood flow. Antilipemic, lipids are fats, so against fats, that helps to lower blood cholesterol and fats in the bloodstream. And then antithrombotic agents. So thrombocytes are our platelets. Antithrombotic agents are medications that work against blood clots. So always break down words, look at the word itself, and try to figure out what we're working with. Instead of being overwhelmed by these medical terms, we can kind of break them down, and we've already learned a lot of these words in previous chapters. Antiarrhythmic medications. An arrhythmia refers to any change from the normal sequence of electrical impulses of the heart. Antiarrhythmic agents include a variety of drugs that act in different ways to suppress various types of cardiac arrhythmias. Physicians will select a particular antiarrhythmic agent based on careful assessment of many factors, including the type of arrhythmia, frequency, so how often it's occurring, and cardiac, renal, or other pathological conditions, along with current signs and symptoms. Proper patient education is important for individuals taking antiarrhythmics. They should be informed that lifestyle modifications may need to be done to reduce stress. Sometimes the arrhythmia is actually related to stress and is more likely to kind of be more frequent if a patient is highly stressed. Mild exercise on a regular basis can be helpful, and the patient should rise slowly if getting up from a reclining position. Patient education is so important, and a lot of these medications, as they work on the arrhythmia, they can also lower the blood pressure, and that makes it harder when we're going from laying down to sitting to standing for our blood pressure to regulate. That's why patients need to rise slowly if getting up from a reclining position. To allow proper absorption, patients should take the medication with a full glass of water on an empty stomach 1 hour or before or 2 hours after a meal. Lastly, patients should be instructed to contact their physician to report any adverse side effects or if they have questions about the medication. The table below shows the various types of antiarrhythmic medications, their general indication, side effects, and toxicity concerns. The first medication here is adenosine. Indication used to restore normal sinus rhythm in paroxysmal supraventricular tachycardia, PSVT. SVT is a rhythm where the heart has this aberrant electrical conduction, causing a very, very rapid and life-threatening arrhythmia, and it occurs in the kind of top chambers of the heart. So the adenosine works to slow down conduction through the atrioventricular node. When we give this injectably, if it works, it actually causes this kind of pause in the rhythm before the heart goes back into a normal sinus rhythm. So I do like to warn people that they will have this sensation almost of their heart stopping before it restarts, just because I want them to not be fearful when that does occur. The side effects are facial flushing, lightheadedness, headache, dyspnea, and chest pressure. Toxicity concern, none noted. The next medication is amiodarone. It's used for the treatment of refractory, life-threatening ventricular arrhythmias. Side effects are pulmonary fibrosis, cardiac arrhythmias, neurotoxicity, visual disturbance, and dermatological reactions. Amiodarone does have a black box warning. However, because it is used for these refractory arrhythmias that keep reoccurring, ventricular arrhythmias are deadly. And so it's used if the benefit outweighs the risk. There is an oral version as well as an IV version, and the risks are much greater for our elderly. And so we typically try not to use this unless absolutely needed in our older population because of that black box warning. The toxicity concerns for this one are thyrotoxic and neurotoxic adverse effects in that older population. Are beta adrenergic blockers used in the treatment of hypertension and some forms of chronic angina, which remember is that chest pain. Side effects, hypotension, because we're treating hypertension, we can drop too low. Bradycardia, slow heart rate. Dizziness, irritability, confusion. Hypoglycemia, bronchospasm, and impotence. Our beta blockers, some are specific to beta 1 or specific channels. Some are nonspecific and they block both beta 1 and beta 2, which is why there can be bronchospasm because there are also beta channels within the lungs. Toxicity concerns for our beta blockers, none noted. Calcium channel blockers, the indication is treating atrial fibrillation or flutter and PSVT. Atrial fibrillation, I want you to think of the top two chambers of the heart, the atria, kind of quivering. And the quivering action leads the blood to kind of remain in that chamber versus pumping efficiently out into the ventricle. If the blood is remaining in there for too long, it can cause clots in the atria, which then can pump out to the rest of the body, causing a stroke as the clot travels elsewhere, causing other problems. And so atrial fibrillation, this helps to control that arrhythmia, and then typically those patients will also be on some kind of blood thinner to prevent blood clots from forming. The side effects of our calcium channel blockers, hypotension, bradycardia, edema, constipation, nausea, abdominal discomfort. Toxicity concern, none noted. Next we have lidocaine, which is an injectable medication. It is used for the treatment of ventricular arrhythmias. I want you to think about the ventricles as the primary way that blood flows to the body. So on the left side of the heart, that ventricle is where blood pumps out systemically, kind of to the body as a whole. On the right side of the heart, that is where the blood pumps out to the lungs to become oxygenated, returns to that left ventricle to be pumped out to the rest of the body. So ventricular arrhythmias are so deadly for that reason, that they are causing this lack of coordinated motion within those ventricles. You can see how that would quickly lead to cardiac arrest or the heart stopping altogether. So lidocaine used to be a first-line treatment for ventricular arrhythmias. Now we typically start with amiodarone. It is still part of the algorithm, however, in advanced cardiac life-saving efforts when we're doing CPR or something of that sort within the emergency department or an ICU type of setting. The side effects of lidocaine are central nervous system symptoms, including tremors, seizures, dizziness, confusion and blurred vision, hypotension, bradycardia, heart block, dyspnea, respiratory depression, and arrest. Toxicity concern, none noted. Next, we have procainamide. It's a potential treatment alternative to amiodarone for the treatment of ventricular tachycardia during cardiopulmonary resuscitation. Again, this is an injectable medication. The side effects are diarrhea, anorexia, nausea, vomiting, abdominal pain, tachycardia, QT prolongation, hypotension, syncope, dry mouth, blurred vision, confusion, vascular collapse, and respiratory arrest. Toxicity concern, none noted. Lastly, we have propafenone. This is used to treat symptomatic supraventricular arrhythmias or severe life-threatening ventricular arrhythmias. This is an oral antiarrhythmic agent, and it is also useful in converting atrial fibrillation to sinus rhythm and maintaining it. It's not one that I truly see used a lot. I haven't actually ever seen a patient who's prescribed this, and so our main ones are going to be on the first slide, the one before this. These ones I wouldn't be as concerned with. The side effects of the propafenone are dizziness and blurred vision, nausea, vomiting, unusual taste, constipation, angina, heart failure, palpitations, arrhythmia, dyspnea, fatigue, weakness, and headache. Toxicity concern, none noted. Knowledge check. Which antiarrhythmic medication is used to treat atrial fibrillation? A. Calcium channel blockers. B. Beta-adrenergic blockers. C. Adenosine. D. Amiodarone. And the answer is A. Calcium channel blockers. Moving on to antihypertensive medications. It's important to know that antihypertensives do not cure hypertension, they only control it. After withdrawal from an antihypertensive, an individual's blood pressure will return to levels similar to that before treatment with the medication. So if you ever hear a patient say something like, well, I only take these medications once in a while, or I'm going to take these for a short period of time and then I won't have to take them anymore. That's not accurate because they are only controlling the hypertension. Now, if a patient changes their lifestyle, they lose a lot of weight, they're on a diet that can help control their blood pressure without needing a medication, they may be able to help lower their blood pressure naturally. But the medications themselves do not cure the disease, they only control it. There are 6 classifications of antihypertensive. These are as follows. Your thiazide diuretics, which we spoke about in the renal lecture. Your beta-adrenergic and calcium channel blockers. ACE inhibitors. Angiotensin receptor blockers, or ARBs. Anti-adrenergic agents, and peripheral vasodilators. Antihypertensive classifications. First classification, the thiazide diuretics. You'll remember we talked about these in the renal lecture. And most patients meeting criteria for drug therapy should be started on thiazides either alone or in combination with a drug from one of the other drug classes because they're generally well tolerated, have less side effects, and are also inexpensive. The side effects are hypokalemia. Remember that thiazide diuretics can cause excess excretion of potassium as well as sodium, muscle weakness or spasm, postural hypotension, dizziness, and hyperglycemia. Next, we have the beta-adrenergic and calcium channel blockers. These are also generally well tolerated and suitable for initial therapy in many different conditions, including certain arrhythmias and heart failure. Sometimes they are more specific to beta 1, beta 2, Sometimes they are not. And so this can cause bronchospasms in the lungs. That's one of the side effects listed here because there's also beta receptors in the lungs. Hypotension, bradycardia, fatigue, nausea, vomiting, and hypoglycemia. Next, we have your ACE inhibitors. ACE inhibitors lower blood pressure by decreasing vasoconstriction. And because of this, they're acting on the blood vessels themselves. There are not significant changes in heart rate or cardiac output. So this is great in the treatment of hypertension alone, but if we are looking at an arrhythmia, this is not going to be one that will have as much success. The side effects are rash or photosensitivity, hypotension, chronic dry cough or nasal congestion, which can be resolved by switching to an A or B class, and hyperkalemia. Monitor serum potassium levels periodically. Next, we have the angiotensin receptor blockers, ARBs. These are similar to ACE inhibitors and generally used as alternatives for people who have a reaction to the ACE inhibitors. They are a great choice for people with other serious conditions, comorbidities such as heart failure, diabetes, and renal disease, and typically used in conjunction with thiazide diuretics. We have antiadrenergic agents. These can cause tachycardia, palpitations, headache and flushing, orthostatic hypotension, and GI effects, including nausea, vomiting, diarrhea, and constipation, and blood abnormalities, edema, and weight gain. They give two examples in your book. One of them is clonidine, which is a centrally acting alpha adrenergic blocking agent, and the other is prazosin, which is a peripheral acting alpha adrenergic blocker. Last, we have your peripheral vasodilators. The example they give in the book is hydralazine, sometimes used in the treatment of moderate to severe hypertension. And this is one that we give oftentimes IV if somebody comes into the hospital with a very high blood pressure that we need to treat quickly. The side effects are very similar to the antiadrenergic agent side effects, including tachycardia, palpitations, headache and flushing, orthostatic hypotension, and GI effects, blood abnormalities, edema, and weight gain. This slide shows a great visual representation of antihypertensives within the body. So if you start here at the heart, our beta adrenergic blockers reduce cardiac output by decreasing heart rate and force of contraction. For example, carvedilol and metoprolol are the two drugs they give here. Moving along the cycle here, alpha adrenergic blockers work on the arterioles to block the alpha effects from the nervous system, therefore causing vasodilation. The example here is prazosin, which is also called minipress. Your calcium channel blockers block calcium ion channels needed for smooth muscle contraction, therefore causing smooth muscle relaxation and resulting vasodilation or opening of the veins and vessels. Example drugs are amlodipine and verapamil. Peripheral vasodilators cause smooth muscle relaxation of arterioles, causing direct vasodilation, for example, hydralazine. Moving down here, we have our angiotensin receptor blockers, which prevent angiotensin II from reaching receptors, therefore causing vasodilation. Your ACE inhibitors block the formation of angiotensin II from causing vasoconstriction, therefore causing vasodilation. Also blocks aldosterone secretion, thereby causing increased urine output. And then your thiazide diuretics decrease blood volume by increasing urine output. The example drug here is hydrochlorothiazide. If you're a visual learner, this is a great slide for you. Knowledge check. Which is not considered a classification of an antihypertensive medication? A, ACE inhibitor, B, peripheral vasodilator, C, cholinergics, D, thiazide diuretics. And the answer is C, cholinergics. Moving on to our coronary vasodilators. Coronary part, vasodilators, opening of the vessels. Coronary vasodilators are used in the treatment of angina. When there is insufficient blood supply to a part of the heart, also known as ischemia, the result is acute pain. Vasodilators are administered to dilate blood vessels and stop attacks of angina or reduce the frequency of angina when administered prophylactically. If we give a medication prophylactically, it means we are giving it so that the thing never occurs. So treating it is once the symptom has already occurred. Prophylactically is to prevent it from occurring. The image here shows how this works. So beta blockers can be used to treat angina. They decrease the rate and force of contraction of the heart, thereby reducing workload and oxygen demand. Your calcium channel blockers dilate arterial smooth muscle, causing vasodilation and decreasing blood pressure and cardiac oxygen demand. Your coronary vasodilators themselves dilate the coronary arteries to increase blood supply and oxygen delivery to the heart. In addition, reduce venous blood return to the heart. Example is nitroglycerin, which is the drug that we give when somebody is experiencing acute chest pain as well, because it will help to temporarily open up the blood vessels that feed the heart itself. So listed here in a little more detail, the 3 different coronary vasodilators include your nitrates, like nitroglycerin, used for relief of acute angina pectoris and for long-term prophylactic management. Side effects can include headache, postural hypotension, blurred vision, dry mouth, and hypersensitivity reactions. I try to explain it to my patients like you are not only opening up the blood vessels in the heart for more blood flow, but you're opening up blood vessels everywhere for more blood flow by causing this relaxation, which can lead to headaches, can lead to that dizziness, the drop in blood pressure throughout the body. Some contraindications for nitrates, people with glaucoma, GI hypermotility or malabsorption, intracranial pressure, severe anemia, or persistent hypotension or a condition of hypotension that occurs regularly. You also want to make sure patients know not to take this with alcohol. It can also interact with medications such as Viagra and can cause a potentiated hypotensive effect, your phosphodiesterase inhibitors. Many times people will be taking this long-term for prophylaxis, but again, it's also used in acute heart attacks or chest pain. And what we do in the hospital as well as sometimes in the paramedics, usually the paramedics use either a spray or a one that goes under the tongue. But we also use these patches that you put this nitro paste on. It's nitroglycerin paste, and it goes on the skin and it's absorbed directly through the skin. It's really important if a patient has one of those that we know it's on, and that if we have to remove it, we wipe all of it off and place a new one in a different spot. The old one has to be completely removed before we place a new one. The other thing is because it's absorbed through the skin, you have to be very careful while handling it, making sure you're wearing gloves and never touching it because you don't want your blood pressure to drop drastically while applying it to a patient. We also have beta blockers. They decrease the rate and force of the contraction of the heart, reducing the workload and oxygen demand. The side effects you can see on the previous slides. And then our calcium channel blockers. They dilate arterial smooth muscle, causing vasodilation, thereby decreasing blood pressure and cardiac oxygen demand. Knowledge check. Coronary vasodilators are used to treat A, high blood pressure, B, angina, C, high cholesterol, D, diabetes. And the answer is B, angina. Moving on to anti-lipemic drugs. Remember, against lipemic is lipids or fats, so anti-lipemic agents are used to lower blood cholesterol levels. Lipoproteins are responsible for transporting cholesterol and other fats through the bloodstream. So you'll see here that they talk about LDLs, low-density lipoproteins, also known as the bad cholesterol. They carry the largest amount of cholesterol in the blood and are responsible for transporting and depositing it into the arterial walls. Triglycerides, TG, are a source of energy. Excess dietary calories are converted to triglycerides and stored as fat in the adipose tissue for future energy needs. So, excess triglycerides can be an independent risk factor leading to coronary heart disease and atherosclerosis. We also have high density lipoproteins, HDLs, which are the good cholesterol. They help transport the LDL cholesterol from the walls of the arteries through the bloodstream to the liver for excretion. So we want those because we want to be moving this cholesterol away from the walls of the arteries and into the liver for excretion. So your first antilipemic category is your statins. These are the first choice in managing high cholesterol. They're effective in lowering LDL levels, so lowering the bad cholesterol, and are modestly effective in reducing triglyceride levels and increasing HDL levels. Statins are generally well tolerated. Next, we have bile acid sequestrants. These bind bile acids in the intestine and interrupt the process by which the bile acids are returned to the liver for reuse. Because bile acids are formed from cholesterol, the sequestrants reduce total body cholesterol since they can't be returned for reuse. They should not be used as a single agent in the presence of elevated triglycerides, so they're not going to be effective enough if elevated triglycerides are the concern. Next, we have nicotinic acid or niacin. Nicotinic acid reduces the hepatic synthesis of triglycerides and inhibits the mobilization of free fatty acids from the peripheral tissue. It assists in lowering total and LDL cholesterols and triglycerol levels in the serum. It also raises HDL cholesterol levels, and it's generally reserved for patients who cannot tolerate other antilipemic drug classes. So we typically do start with the statins, and then we will move towards these other categories. Next, we have the fibric acid derivatives or fibrates. These are especially effective in patients who have extremely high triglyceride levels and elevated cholesterol levels, and in patients with combined forms of hyperlipidemia. This form of treatment is a good choice for diabetics because they also improve glucose tolerance. We also have cholesterol absorption inhibitors. All absorption inhibitors moderately reduce LDL levels by inhibiting intestinal absorption of both dietary and biliary cholesterol, blocking its transport in the small intestine. They can also be taken simultaneously for potentiated effect with statin medications. Last, we have omega-3 fatty acids. These assist in the prevention of primary and secondary heart disease and reduce triglyceride levels. Knowledge check. Which antilipemic agent should not be used as a single agent in the presence of elevated triglycerides? A. Bile acid sequestrants. B. Cholesterol absorption inhibitors. C. Statins. D. Omega-3 fatty acids. The answer is A. Bile acid sequestrants. Case study activity. A 27-year-old patient presents for an annual physical and lab draw. Upon review of the patient's cholesterol panel, the physician found normal cholesterol levels but elevated triglyceride levels. Which antilipemic drug therapy would the physician recommend? A. Cholesterol absorption inhibitor. B. Fibric acid derivatives. C. Nicotinic acid. D. Omega-3 fatty acid. Remember, there's only one of these four that would be recommended for elevated triglycerides if cholesterol is normal. And the answer is D. Omega-3 fatty acid. Another important category of cardiovascular medications is antithrombotic agents. Antithrombotic agents interfere with or prevent thrombosis or blood coagulation. The three categories include anticoagulants, platelet inhibitors, and thrombolytics. Anticoagulants, the action is to prevent the formation of the fibrin clot by interfering with one of the steps leading to fibrin formation. Common drugs used are warfarin and heparin. Warfarin is given via oral administration, and heparin is injectable either subcutaneously or intravenously in some severe cases. It's important for these that there is an antidote because if the bleeding becomes uncontrolled, we may need to reverse the action of the drug. The antidote for warfarin is prothrombin complex concentrate or fresh frozen plasma and vitamin K. Heparin, the injectable administration, the antidote is protamine sulfate. The next category is platelet inhibitors. The action of platelet inhibitors is to interfere with the activation pathways to prevent platelet clumping. And these are given as prophylactic, so again, preventative therapy, or secondary prevention to prevent a second or further complication of patients with a recent stroke, myocardial infarction, or established peripheral vascular disease. So all of these can be caused by a clot that causes ischemia and lack of oxygen flow. A heart attack, stroke, and peripheral vascular disease can lead to deep vein thrombosis, which is a blood clot in the peripheral vasculature, and then also pulmonary embolism, which is a blood clot in the lungs. Common drugs used that are platelet inhibitors are dipyridamole, aspirin, and clopidogrel. All three are orally administered, and there are no antidotes for these. So that can be dangerous. That is a consideration when we're giving these, especially to elderly patients who, if they hit their head, have excessive bleeding, already have decreased ability to make platelets due to aging. These are drugs we might want to consider trying a different therapy, such as warfarin, because there is an antidote. In last category, we have your thrombolytics. Lytics or lysing is like think of like destroying a cell or killing a cell. So thrombolytics actually dissolve and liquefy the fibrin of an existing clot. So this is given when there's already a clot. And the common drug used is reteplase and alteplase, also tenecteplase. These are both administered through IV, and these are given in severe cases. So, for example, if I have a patient that comes in with a massive stroke and we see on the imaging that they have a large clot, we will sometimes give a thrombolytic, but then the patient has to be closely monitored because there was a big clot there that we've now dissolved. This can lead to a reperfusion injury as blood rushes to the spot. It can even lead to excessive bleeding, causing a more severe problem than the clot itself caused. So thrombolytics are not something that's given prophylactically. They're given only to dissolve and liquefy an existing clot. Knowledge check. Which represents the most used orally administered anticoagulant drug? A. Heparin, B. Warfarin, C. Reteplase, D. Aspirin. The answer is B. Warfarin. The next few slides have some cardiovascular system medication patient education. I've talked a little bit about some of this kind of sprinkled throughout, but here's a good overview. Your cardiac glycosides, important education is to recognize and report immediate side effects. If the side effects occur, hold the medication until a physician can be consulted. Avoid over-the-counter medications, especially antacids and cold remedies. Check the heart rate on a regular basis. Avoid abrupt withdrawal. These must be reduced gradually under physician supervision, and do not take other medications at the same time without physician approval. Your antiarrhythmic agents, immediately report adverse side effects. If side effects occur, hold the medication until a physician can be consulted. Rise slowly from a reclining position. Again, that orthostatic hypotension, people can drop their blood pressure very quickly if they're changing positions. We want to encourage lifestyle modifications to reduce stress and hopefully reduce the chance of the dysrhythmia or the arrhythmia reoccurring. Do not discontinue the medication unless instructed by a physician. Take a proper dose of medication. Do not skip any doses. Do not double up on the dose if medication was forgotten. So this one's really important. Some medications, you do double up on the dose if you forgot a dose, but for antiarrhythmics, very dangerous to do that. So do not double up. Just count that one as a missed dose. As always, discard any expired medications. Take these on an empty stomach and with a full glass of water 1 hour before meals or 2 hours after a meal. And contact your physician immediately with any concerns. For your antihypertensives, routinely monitor blood pressure at home and share information with your physician. Immediately report any adverse side effects. Take medication on time as prescribed by the physician. Rise slowly from a reclining position. Be cautious in driving a car or operating machinery if the medication causes drowsiness. For some people, it does. Oftentimes, they will recommend that these are taken at night, actually, because they can cause drowsiness. Reduce or stop smoking to help lower blood pressure. Avoid hot tubs and hot showers, which could cause dizziness and fainting. Avoid grapefruit juice while taking calcium channel blockers. And incorporate lifestyle modifications such as exercise, limiting alcohol use, and healthy eating habits. They'll also recommend oftentimes a DASH diet, which is a low-sodium, heart-healthy diet. For the coronary vasodilators, important patient education includes administering fast-acting preparation while sitting down. Rise slowly from reclining position. Do not drink alcohol or take PDE inhibitors while taking this medication, as we discussed. PDE inhibitors are like Viagra. Take time-release capsules or tablets on an empty stomach with a full glass of water. Allow sublingual tablets to dissolve under the tongue or in the cheek and do not chew or swallow them. When we're talking about nitroglycerin, repeat sublingual tablets or spray every 5 to 10 minutes for a maximum of 3 tablets or 3 sprays for chest pain. If no relief, activate emergency medical services. Do not discontinue the medication suddenly, only do so under the direction of a physician. And administer a sublingual tablet or spray before physical exertion or emotional stress. Your antilipemics, important patient education is to continue a low-fat, low-cholesterol diet with aerobic exercise, so we don't just take the pill and expect it to fix everything. Take medication with meals to reduce gastrointestinal upset. Report side effects immediately to the physician. Expect facial flushing with niacin unless using extended-release formula, so that's a expected side effect. Take your statin medications in the evenings when they'll work best. A list of all medications should be brought to your physician, including herbal and non-prescription drugs, and avoid grapefruit while taking statins. Anticoagulant therapy. It's important to take the medication as prescribed and complete required laboratory monitoring. So, for example, for warfarin, those patients will go in for routine blood clotting level and warfarin level tests because they want to make sure that it's in the therapeutic range. Take the medication at the same time every day. Do not change brands of medication without physician approval. Avoid eating large amounts of grapefruit or drinking grapefruit juice or cranberry juice. Avoid activities and contact sports that may cause injuries, cuts, or bruises. Always wear closed-toed shoes. Use a soft toothbrush and electric razor to prevent cuts while shaving. We want to be mindful of causing any bleeding because it's going to be harder for your blood to clot, which is the purpose of it. But then also we don't want to have any injuries that would require us to clot because we can lose more blood. Report allergic reactions to the physician. Avoid smoking, use of alcohol, and over-the-counter medications. Wear identification and alerts at all times, keeping all follow-up appointments with your physician. And use reliable birth control methods. So unfortunately, patients on anticoagulant therapy, if they do get pregnant, it can pose a serious risk and serious side effects to the fetus. And actually, I've been going through this with a family member of mine who has a clotting disorder. When they decide to get pregnant or try to get pregnant, they actually have to switch to an injectable and one that, they have to be monitoring very closely versus an oral pill. So I've been kind of alongside her for this journey and seen a lot of that. So it's important that you're using reliable birth control methods. If you're thinking about getting pregnant, that you talk to your doctor and see a specialist to change which medications you're on and make sure that it's safe. Knowledge check. Which cardiovascular medication system category should avoid contact sports that could cause cuts or bruising? A. Antihypertensives. B. Coronary vasodilators. C. Antilipemic therapy. D. Anticoagulant therapy. And the answer is D. Anticoagulant therapy. Self-assessment. What are calcium channel blockers used for? What type of antithrombotic therapies are administered through IV? What are the 6 categories of antilipemic agents? Thank you for listening. This has been Chapter 14 of Essentials of Pharmacology for Health Professions, 9th edition.